My name's Nicole Peterson. I'm a geriatric nurse practitioner. I work at the University of Iowa College of Nursing. IPOST stands for Iowa Physician's Orders for Scope of Treatment. And what that means is it's a medical order that documents what patients' wishes are for care at the end of life. So those people who are eligible, we ask the question of, would I be surprised if they were going to pass away within the next 12 months? If you're not surprised for whatever reason, that really makes them qualified for an IPOST. Usually includes the frail and elderly, people with chronic medical illnesses who have maybe had a lot of hospitalizations, who have really life-limiting diseases. This also includes children as well as adults. So the IPOST itself is a salmon-colored document. It's printed on a hard cardstock form. It is goes with the patient to whatever clinical setting they may be in. So if they're in the nursing home, it's in their chart. If they're at home, it's usually kept on the refrigerator. And if they transfer to the hospital for any reason, they take it with them so that they have that medical order that follows them. In order for the IPOST to become a medical order, it must be signed by the patient if they have decision-making capacity, or the durable power of attorney, and also must be signed by a physician, physician's assistant, or a nurse practitioner. So once the document is signed, it is immediately a medical order and can be documented in the patient's chart of what their wishes are. It can be followed by any healthcare provider at that point, which could include nurses in a nursing home. It could include EMTs, or it could include any healthcare provider in a facility. So when a person is discussing their wishes for end of life with their healthcare provider, it's important to talk about what is important for them, as well as what they want their medical care to look like now and in the future. So this can be pretty specific. It can be something as broad as, I don't want to go to the hospital. I want to be kept comfortable wherever I am, wherever it may be that I'm living. It could be more broad, like, I want everything done for me. So I want to go to the hospital. I want to have intensive care treatment. I want to be into the ICU. I want to be on any machine, any treatment that will keep me alive. Can also be specific as to what types of treatments I want and what types of treatments I don't want. So you can be specific and say, I do want some treatment. I want some comfort measures for my breathing, but I don't want to be intubated. You can make it as specific as you would like it to be. So as a primary care provider, IPOST has been very helpful for me to help guide care for patients. Sometimes I know the patients well, and I actually am the person who has the advanced care planning discussions with them, and I have a good idea of what the patients and their families would like. It's also helpful in transferring patients between different care settings to know that they have this document and this has already been discussed. So as I'm getting to know the person for the first time, they've actually had this illness that they've been dealing with, and they have already discussed what their wishes are. It's helpful as the new primary care provider to know what that is. It also helps family members who, when it's their time to become the durable power of attorney and they have to make those decisions, that can be very emotional. Emotional because they have to deal with their family member who's becoming more sick, as well as they now have the stress of making the decisions. I've had people who tell me later, oh my gosh, I am so happy we had this conversation ahead of time so that I know what mom wants and I know that this is what mom would have wanted. It kind of takes that stress off of them to know that they're doing the right thing, that they are making the appropriate decisions. And it's very helpful for them to hear exactly what those wishes are. So the biggest advantage of having an IPOST is actually the focus on the advanced care planning discussion. It really gives patients and their family members an avenue to be able to discuss what impacts them, what gives their lives meaning and what is really important to them. It also gives them a way, with the facilitated discussions, to think about a lot of different scenarios that they maybe haven't talked about before. Some of my patients have told me that this is something that they think about quite a bit, but they don't feel comfortable talking to their families about. It's an uncomfortable topic sometimes for them to bring up to their children. But the real value I have seen for patients who have an IPOST is they feel relieved after the conversation has been completed. They feel like they've gotten a lot of things off their chest, that they can really feel comfortable knowing that their families know exactly what they want. It's very empowering for the patients and their families to be able to have that discussion with their healthcare provider.